Hello. Today my patient was a 70-year-old male who's post-op 5 days from a cervical laminoplasty. He has not had a bowel movement since the day before his surgery, so 5 or 6 days ago. He has orthostatic hypotension, so he has not been ambulating, and he had pretty bad anxiety. His pain was mostly from his surgical site, but he's also constipated, so he's uncomfortable from that. And like I said, he has a lot of anxiety, so I kind of focused on that as my main nursing focus for the day. Obviously, everything that's going on with him, but especially that because it's something that I noticed from the things that he was saying. His history is his hyperlipidemia, aortic insufficiency, he has prostatic valve regurgitation, thoracic aneurysm, bilateral cataracts, arthritis, depression and anxiety, and he has a valve implant. And just like subjective findings of what I gathered from his anxiety, he was saying things like, I feel trapped, I just want to go home, I don't think my doctor knows what she's doing. So my nursing diagnosis for him was that he had anxiety due to the inability to walk from the orthostatic hypotension, as evidenced by those things that he stated. There's not a lot that I can do with the orthostatic hypotension, but I watched with the physical therapist, and they were giving him a medication that did raise his blood pressure, even though he's usually on medication that lowers his blood pressure, so he was kind of confused about that. So I educated him about that. His vitals were good other than his blood pressure all day. He had a lot of bowel sounds present, but like I said, he hadn't had a bowel movement in like 5 or 6 days, so that was a top priority too. I was just monitoring for that, giving him medicine for constipation, so more than he had been, I guess. But I also educated him because he can't move is probably part of that. And he expressed that he was having a difficult time going because he knew he wanted to be able to walk to the bathroom by himself. So I think there was a lot of anxiety there, and not wanting to do it like in the bed or with someone around. Let's see. He has a wife and a daughter that were there. The wife is there all day long. They've been married for 50 years, so he has a really good support system at home, so I wasn't really worried about that. He had good muscle strength in his upper and lower extremities. AO times 3. Cardiac sounds were present. No bruits. Pulses 2+. Rate and rhythm regular. Lungs were clear, auscultation, no extra sounds. Like I said, he had really good bowel sounds. I could hear him in his chest. So he had low hemoglobin, hematocrit, and red blood cells, so I didn't know if that might be a disease-specific lab value that might be like contributing to the orthostatic hypotension. But then so the short-term planning was that patient will demonstrate mobility and circulation exercises back to me and express relief in the anxiety by the end of shift, and he did. So he said he felt more confident after I talked to him about like what he needs to do in bed, since he can't get up and move like walking wise. So that felt really good to be able to educate him about that, teach him something that he didn't know. And then he was able to ambulate with a physical therapist. He walked like 80 feet. So hopefully he'll be going to the bathroom soon and going home soon, because the only reason why he was staying was because he hadn't been ambulating. And then long-term discharge was that the patient will be able to walk without the orthostatic hypotension.